Hey, you're listening to MIG's Front Page with Peter Movilla.
Today we'll be discussing the paper titled Association Between Preoperative Adenomyosis Detection Rate During Pelvic Ultrasonography and the Specialty of the Reading Physician. In this paper, a total of 412 cases of histopathologically confirmed positive adenomyosis were identified between the years of 2011 to 2017. The objective of the paper was to compare the detection rate of adenomyosis when ultrasound was performed by either a radiologist or a gynecologic expert sonologist. They identified a significant difference in the detection rate of adenomyosis, specifically when the ultrasound was performed by an expert gynecologic sonologist. We have with us today two of the leading authors, Dr. Emad Mikhail and Dr. Lauri Hochberg, both from the University of South Florida. Thank you both for being here.
Thank you for the invitation.
I'd love to jump right into it. First question. What was kind of your motivation for beginning this study?
Regarding adenomyosis, it's a very interesting disease. It's very common. We only know that it's about present in 30% of hysterectomy specimens. I believe it's going to be, the prevalence is even more than that. The initial idea about this study came about when we had a lot of patients who are referred to us from other physicians, and they present with a normal ultrasound. So they have a lot of symptoms, and their ultrasound report is completely normal. So I tell the patient, maybe we should repeat your ultrasound. And we started to repeat the imaging study in our specialized gynecology ultrasound unit, and we started to see finding. Initially, the patients was kind of hesitant, why we are repeating the study that I just did. But then I thought we better look it into in a systemic way. So we started to do, let's look on the detection rate for adenomyosis in ultrasound.
Dr. Hochberg, if we can go to you. Who was considered expert gynecologic sonographers in this study, and how does one become an expert gynecologic sonographer?
There are different pathways to become an expert gynecologic imager, and I'll tell you about mine. I began as a OBGYN resident, general OBGYN practitioner, and a few years into practice, I started working with my mentor, Dr. Anna Parsons, and she started to teach me about gynecologic imaging, and I loved it. And I started to focus my practice on gynecologic imaging and using it to help diagnose and manage patients with gynecologic problems. Just to talk about what is an expert, the AIUM stands for the American Institute of Ultrasound and Medicine, and it's really the group in the US that will make training guidelines, and you can actually get credentialed to become a gynecologic ultrasound practitioner here. And it has to do with completing residency, the amount of ultrasound exams per year, and also completing CMEs. There's no definition of an expert. In Europe, the European Federation of Societies for Ultrasound in Medicine and Biology is the group that oversees ultrasound in Europe. And they have a definition of an expert sonologist. They have a level 1, 2, and 3 practitioner. And really, it depends on the amount of ultrasounds performed, how many are done yearly, and really, level 3 is someone who spends the majority of their time undertaking gynecologic ultrasound teaching, research, and development. So according to their definition, I am a level 3 expert.
Can you describe to us some of the sonographic findings that might lead you to suspect that a patient has adenomyosis based on the transvaginal ultrasound?
Adenomyosis, there are some typical features that are seen with ultrasound. And this slide is from the MUSA group, which stands for the Morphological Uterus Sonographic Assessment Group. This was a group of experts that came together to talk about typical findings, to create terms, definitions, and really standardize the description of ultrasound to describe different masses, including adenomyosis. So this schematic is borrowed from that group, and I'm going to go over some of the findings here, and then I'd like to show you some ultrasound images as well. So here are some typical findings of adenomyosis. So this is a uterus. This is a schematic picture of a uterus. Asymmetric thickening of the myometrium, myometrial cysts, hyperechoic islands, fan-shaped shadowing, subendometrial lines and buds, translesional vascularity, and either an irregular or interrupted junctional zone. So here are some ultrasound pictures that will also describe some examples of adenomyosis. So here is a uterus in the sagittal plane. This happened to be a saline infusion sonogram where fluid was put into the cavity because often the endometrium is difficult to define due to the interrupted junctional zone. So this is asymmetric thickening of myometrium. The anterior myometrium is much thinner than the posterior. This is a dramatic example. Also, fan-shaped shadowing is seen here. This is another picture of globular uterus. Again, notice how the endometrium is difficult to define, but it's here, fan-shaped shadowing. Here's another example, uterus with myometrial cysts. Here's another globular uterus. Again, very indistinct junctional zone or not present at all. Here's an example of subendometrial lines and buds. You can almost see the endometrium invading into the myometrium here. Here's a 3D picture of adenomyosis. So this is our sagittal view, transverse, and coronal image. And if you look at this picture here, this is actually an inversion of the coronal image. You can actually, this is the cavity. You can see the black endometrium invading right into the myometrium.
Dr. Mikhail, we'd like to kind of discuss some of the results from your study, particularly looking at table 1.
So we had like 6 years worth of data. We only included hysterectomy specimens where it has adenomyosis on the pathology specimen. We excluded all cases that might be incidental findings, like cases are done for malignancy, for urogynecological indications. So we ended up including about 412 patients. And we looked back in the ultrasound reports for those patients, and we compared both groups, the one who done by radiology versus an ultrasound gynecologic sonologist. So we compared both, and when you look at table 1, you're going to see that it's almost an homogeneous group. So regarding age, BMI, parity, history of prior C-sections, there is no difference between the groups. The only little bit of a difference is race. And we've seen that in the GYN sonologist group, there is a little bit of a significant difference in the white race. We believe that this is because of the setup of the practice where people with insurance get to be referred more to the GYN sonologist group compared to, for example, the resident clinic where they actually don't get that opportunity for imaging. We found that the detection rate in the GYN sonologist group is about 55% compared to only 12% in the radiology group. This was the crude initial values. After that, we did a logistic regression model where we included all the factors that we think might contribute to the difference regarding if there is fibroids, if there is history of C-sections, all of these factors. And again, after controlling for all the variables, we still found 7 times odds ratio of detection in the GYN sonologist group.
Were there any surprising results from your study?
So actually, one of the other surprises that we found that although we believe we are trying to do a great job, we still need to improve our detection rate. So although we are 7 times more odds ratio, our crude detection rate was only 55%, where I think it should be higher than this. We also found that fibroids actually decreases the detection rate in both groups, in the radiology group and the GYN sonologist group. This is an initial study that it will initiate our work in ultrasound detection for adenomyosis. So it is, although there is a lot of findings, but there is a lot of things that we did not control for, including ultrasound machine, including the ultrasound technician, including access to patient history. Including also utilization of 3D ultrasound. So I think this is a thought-provoking findings that will help us and give us some ideas on future studies.
Dr. Hochberg, now that we know what we need, how do you, advise or counsel that we get patients to see more expert gynecologic sonographers, or at least have more of them available for our patients to read their ultrasounds?
So there's been some interest in really increasing or standardizing ultrasound curriculum for residency programs, for residents in OBGYN. And this paper came out in January 2018, and this group is from the AIUM, and it's a really consensus report talking about what exactly should be covered during OBGYN residencies in regards to ultrasound training. And it breaks down per year what should be learned, what skills to understand for both OB and GYN ultrasound. So I think step one is going to be improving our ultrasound curriculum for graduating OBGYN residents. And then I also feel that understanding what physicians are performing your ultrasounds. So either the OBGYN physician themselves might be doing the ultrasound, which to me is the best way to understand these problems. Real-time imaging while the patient is there, asking them how they feel, getting a history, I think is what makes us understand this problem better and see it more often. And I think doctors like Dr. Mikhail, I'm so excited to work with him because we work together to help these patients. He's there, I'm there, we're both there. We look at the pictures together. It's the only way. Whereas taking pictures and reading from another room somewhere, I think you would miss a lot. Also, I think that if you are going to order ultrasound examinations, then I think it's important to know what the experience is of that physician reading, whether they're a radiologist or an OBGYN physician that's an imager like me. And one way to know, I was thinking, how will you know what their experience is? Maybe you could go on the AIUM website and see if they're credentialed. And to me, even though there's no definition of an expert yet, if that doctor is credentialed in 3D GYN imaging, most likely they have expertise in GYN imaging. So maybe that'll help.
Well, thank you guys both for this very informative and honestly fun learning experience with this podcast.
Thank you for having us.
Thank you.
Well, thank you guys all for viewing and look forward to seeing you guys for our next podcast.